Thank you. Senator Blackburn.
Thank you, Mr. Chairman, and congratulations to you all. And thanks for allowing us to be up and down and in and out during votes. Mr. Switzer, I want to come to you because I think protecting U.S. innovation is something that is vitally important. And I know a couple of times this morning you've been asked about IP protections. And when we look at some of the trade deals that are being executed, and we look at China, and we look at there are other people that are bad actors, other countries that are bad actors. I want you to talk for just a moment about how systematically you can approach protecting IP, because we're seeing it not only in the pharmaceutical space, as we looked at the active pharmaceutical ingredients, as we look at vaccines and things of that nature, but also as we utilize AI for predictive diagnosis and disease analysis and some of the health technology provisions that have come to be since I got the Software Act, which put health technology into federal statute when I was in the House. And so protecting this is going to be an imperative. So talk about that for me.
Well, thank you very much, Senator, and thank you for your previous work on the legislation. It's very important. Again, the president has made this a priority. He's mentioned China by name. He's mentioned, how other countries use drug pricing to undermine, really which is the intellectual property of our world-leading drug discovery firms. And Secretary Greer has spoken extensively about it. What I can say is, if confirmed, that this is a huge priority of mine. I have a very extensive background. I used to do innovation policy research at the University of California, San Diego for 2 years. At one point, I had every federal unclassified R&D grant between 1994 and 2002 on my home computer. I've literally read hundreds of thousands of short descriptions. It's a very complex problem, but it's one that's at the very top. If we don't continue to protect our IP, if we don't invest in research and development and IP, then we aren't going to continue to lead, be a leading economy or to lead the 21st century. So I will seek every opportunity and every tool available to ensure that I build it in and try to get the buy-in of the president and others and members of Congress, should it require statutory authority, legislative authority, to approve those agreements.
Well, we do think that it is going to be imperative to really bird dog this issue. And I know that Senator Daines talked with you about things that were in the big, beautiful bill, and restoring R&D and interest expensive bonus depreciation is all to help spur this innovation. And then as we look at the global marketplace, as we look at AI and innovation, it is going to be imperative that we do not cede any ground to our competitors or to adversaries. So thank you for that. Mr. Stewart, to you, and thank you for the work you've done as we've looked at fentanyl, opioid, and some of those things. We passed the Halt Fentanyl Act earlier. I know that you, in 2019, you formed a task force that demonstrated the importance of coordinated enforcement efforts as you're looking at fraud in Medicaid, Medicare, CHIP, and those programs. Now, as we worked on the big, beautiful bill, we found out that as much as 25% of Medicaid payments were improper payments and fraud. We know there's an issue with upcoding in Medicare. So talk with me about how that past work would support the work we're going to do here at this committee to try to get rid of this waste and fraud in these entitlement programs?
Well, thank you very much for the question, and I certainly look forward to working with members of this committee as we push forward on issues like Medicaid fraud or fraud in the healthcare sector. A lot of folks like to presume that there is no victim when it comes to a monetary fraud. Well, there are. It's the American taxpayers, and there's a limited bucket of money that's available for healthcare policy. I will form, and I've done this before, I think you referred to our abuse recovery and response team, because as a U.S. attorney in a district that had suffered so bad with respect to the fentanyl and opiate crisis, we knew that it was most important, at least my view was, that we bring both the civil team and the criminal team, multidisciplinary approach, so we could approach this with all information on deck, so we could make sure that both supply and demand were dealt with. But I plan to use those tools as a former prosecutor who had some pretty big results in terms of Medicaid fraud. The numbers to the American economy, it's dramatic. And Secretary Kennedy has said the public debt is a social determinant of public health. And so it's critically important that we do as efficiently as possible with the dollars that we have, the work that we have to do, because the recipients, legitimate recipients of programs like Medicaid, they need those dollars.
Okay.
So thank you for the question.
Thank you. Thanks, Mr. Chairman.